Well, March is Women's History Month, commemorating and celebrating the role of women in American history. And women have also played a vital role in the improvement of medical care across clinical fields, lots of them.
But despite all the achievements, women still face challenges when it comes to being a patient, as we all know too well. Medical reporter Rosemarie Beltz is here to talk about medical conditions that are still, even with all of our education, still going undiagnosed.
Right? I mean, first, medical school for women is up, admissions are up, more women are applying, so right there, but we're still falling short when it comes to being a patient. A lot of it is traditional medical studies actually only use men as subjects, not women.
Oh, that's weird.
Right? So there you go. So right out of the gate, we're not being studied. And then, you know, we're just different. So then conditions, things present differently, which then leads into our first disease that still goes undiagnosed and misdiagnosed in women, which is heart disease, believe it or not. I find this interesting, right, because it's the #1 killer. We always the focus on men. Now, back to that research. Even when women are included in a study, this is interesting. They still somehow link the risk factors to men. One of the biggest heart studies that looked at smoking and heart disease when they linked the two together. Now, men are twice as likely to smoke than women. So therefore, since men smoke more, they then hypothesize, well, then it must be more common in men. So once again, women kind of fall
short.
fall short. So once again, and then, so now women are believe, it doesn't affect me. About 50% of women think it doesn't affect them, when in fact, women have a less chance of surviving a heart attack than men.
Yeah, why is it that women are less likely to survive a heart attack?
So we'll go back to those risk factors again. A lot of times we don't pay attention to them. They're so used to taking care of other family members, they're caretakers. So they go undiagnosed, and then when you wait, and then we're going to lead into the symptoms, kind of fall by the wayside again.
And the symptoms for women when it comes to heart disease are different than it is for men, and which is another reason why it's difficult to diagnose with us, because we're so dismissive of everything. 9 times out of 10, we just say, I'm just tired.
I'm going to take an Advil and lay down.
Right.
Right, and this is interesting. 80% of women have symptoms a month before their actual heart attack.
Are you serious?
At least one symptom.
And what kind of symptoms should we be looking for?
So we have chest pain, right? Shortness of breath. But in women, it's more like a burning feeling and overall achiness. We sometimes have sleeping issues. A lot of issues that might look as like a hormonal, like if you're sweating, you're going through menopause, you think, I'm having a hot flash. When in fact, you could actually be it could be signs of a heart attack. So right there, the hormonal issues separate us from men.
Okay, so in addition to that, I know that we've got the issue with shortness of breath and sweating excessively, upper body pain. It's not like what you see on the commercials when men grab their chest and just fall back. It's very different for women.
And a lot of times women are tired, right? So we're not getting sleep, and now you're tired, so you're going to have extreme fatigue. So there are definitely things, and don't discount them, because we do have the same risk factors, but our hormones, pregnancy plays a factor. We have diabetes that can develop during pregnancy, blood pressure problems that can develop during pregnancy. So really pay attention to that. I mean, it's, we tend to not think things are important. So
what are some of the other things that go undiagnosed?
Well, interestingly enough, endometriosis, which yes, right? So the condition where your uterine lining, so those cells actually grow on the outside of your uterus. So you have menstrual cycle symptoms that are much more severe, much more bleeding. So this can go misdiagnosed as, again, just bad period cramps, when in fact, you can have these abnormal cells growing on your ovaries, your fallopian tubes, into your bowel, into your abdomen. And especially in young women, again, bad periods, a lot of times too, hormones, we kind of get discredited about being emotional. And when we start having symptoms in adolescence, it usually takes 10 to 12 years to diagnose it. And think about it, it really can affect your productivity if you're having headaches, you're nauseous, your social life, your relationships. So it's a big deal.
How do you get your doctor to take you seriously and take the next step to determine whether or not it is endometriosis.
Exactly. So this is when you sort of have to almost be an advocate for yourself. Step up. There are laparoscopic treatments. I mean, first, of course, they're going to try you on pain medicine and hormone therapy. But then, you know, this is a progressive condition that gets worse as you get older. So, you know, and again, it's another time to have a good relationship with your doctor. And don't feel like that you can't talk about it. So again, once again, is we sort of put things by the wayside. So, but nobody should live in excruciating pain like that.
All right, any other things that are very commonly undiagnosed in women?
Well, we have ADHD, unfortunately. So a lot of that's where it's a brain disorder. I'm sure there's a lot of moms watching or parents watching where there's those patterns of impulsiveness, hyperactivity, the ability of not being able to focus in kids. I found this interesting. According to the CDC, the most recent numbers go up to 2016. 9% of kids between the ages of 2 and 17 were diagnosed. When we break down that number, little boys or boys were diagnosed at like 14% of that 9% were boys, where only 6% were girls. So it's double. And mental health professionals think that's very inaccurate. They're thinking that the symptoms and the side effects and sort of the behavior is going undiagnosed because little girls, unfortunately, they have different ways of coping. There's 3 different types of ADHD, and the one type was just with that ability not to focus, and that seems to be the category they fall under. So when they are expressing frustration, they're not really physically or
Acting
verbally
out the way boys do that are more likely to make the mom call the pediatrician.
Right.
Dramatic behavior as opposed to,
Right, we're little girls where they'll be active in activities, but they're still extremely focused when they're doing something. Even if they jump from one activity to the next, they're still really focused. And it's also, again, it's more with their verbal. They might butt in when you're speaking, or their time management. They get a little bit more frustrated when it comes to, or their ability to lose things, or in school age, or not being able to stick to a schedule. So that's not really so much as like a behavioral thing that would be frustrating even to parents.
Yeah, but it is frustrating to the child and still brings that same diagnosis.
Yes.
Rosemarie, great information.
Oh, you're
We're
welcome.
all more equipped to go to our doctors and say, hey, pay attention to me. I know what's
stand up
going
for
on.
yourself, ladies,
Yes.
and be your own advocate. All right, we're going to be right back.